Let's talk about something that's a hidden danger for so many of our pets. It's a condition that can cause some really serious damage, all without any obvious signs. It's so sneaky, in fact, that it's earned a pretty grim nickname, the silent killer.
I mean, think about your own dog or cat right now. They're probably acting totally normal, maybe chasing a ball or begging for a treat. You look at them and you just see a happy, healthy pet.
But what if, underneath all that, their body was under a constant damaging strain? Well, that's the reality of what we call systemic hypertension, or, high blood pressure, in our pets. Let's really dig into what that actually means for them.
Okay, so first up, let's explore why this condition is such a quiet but really significant threat to our furry family members.
So the medical definition sounds pretty technical, right? But the idea behind it is actually really simple. All it means is that the pressure inside your pet's arteries is way too high, and it stays that way. This isn't just a quick spike because they got excited about a car ride. It's a chronic, relentless pressure that's there day in and day out.
And that brings us to the most important part of this whole conversation, something called target organ damage, or TOD for short. See, the high blood pressure itself isn't the final problem. The real danger is the damage that constant pressure does to the body's most important and, frankly, most fragile organs.
And here's what that damage actually looks like. In the eyes, it can cause the retina to detach, leading to sudden, permanent blindness. In the brain, you might see seizures, confusion, or even stroke-like events. The heart muscle literally gets thicker because it's working so hard to pump against all that pressure. And it can absolutely wreck the kidneys, either causing kidney disease or making it much, much worse. These are the stakes we're talking about. It's serious stuff.
So, is there a magic number we should be worried about? Well, according to the experts, a systolic reading of 180 or higher, that's a huge red flag. That's the point where a pet is at severe risk for all that organ damage we just talked about. But actually getting that number accurately, that's not always so simple.
So, if this is a silent condition, how in the world do veterinarians even find it? Well, it's not as easy as just taking one reading. It really requires some careful detective work to get to the bottom of it.
The first big hurdle is something called the white coat effect. I'm sure you've heard of it. Just like us, our pets can get pretty stressed out at the vet's office, and that anxiety can make their blood pressure shoot up temporarily. A good vet knows this and has to figure out, is this pet truly hypertensive, or are they just a little freaked out right now?
To get a truly accurate reading, there's actually a gold standard protocol. It all starts with creating a calm, quiet space, usually with you right there to comfort them. Then they let the pet just chill for 5 or 10 minutes to get used to the room. The equipment has to be exactly the right size, and they'll take a whole series of measurements, like 5 to 7 of them. They even throw out the very first reading and average the rest, all to make sure the number they get is the real deal.
And this is why the official veterinary guidelines are so incredibly clear about this. A diagnosis should never be based on just one high reading at the clinic. It has to be confirmed with reliable measurements taken on multiple different days to prove that it's a persistent, ongoing problem.
Okay, so let's say a pet is diagnosed. What's actually causing the high blood pressure? Well, in most cases, it's not just happening on its own. It's usually a giant clue that something else is going on in their body. And when you look at the breakdown, it's pretty eye-opening. A full 80% of hypertension cases in our pets are what we call secondary. That just means the high blood pressure is a symptom of another disease. Only about 20% of cases are idiopathic, which is just the medical way of saying we don't know the cause.
So what are these culprit diseases? Well, for both dogs and cats, chronic kidney disease is a huge one. For dogs, we also see it a lot with Cushing's disease and diabetes. With cats, on top of kidney disease, hyperthyroidism is another major trigger. That's why getting a hypertension diagnosis often kicks off a whole new investigation to find one of these other conditions. And since all of these underlying diseases are way more common in our senior pets, the expert panel has a really clear recommendation for us. Start doing annual blood pressure checks for every single dog and cat once they turn 9. It's a simple, proactive step that can catch this silent killer before it does major damage.
Now, once a pet is diagnosed, the good news is that this is a very manageable condition. But, and this is a big but, the treatment has to be tailored not just to the patient, but to their species.
The goal of any treatment is really straightforward. Get that systolic blood pressure down below 160. And why that number? Because that's the level where we can dramatically reduce the risk of target organ damage. The whole point is to protect those precious organs, the eyes, brain, heart, and kidneys. Now here is a super important takeaway.
You absolutely cannot treat a dog with high blood pressure the same way you treat a cat. For dogs, vets will usually start with a type of drug called a RAS inhibitor. These help relax the blood vessels, and they have this awesome side effect of also protecting the kidneys. But for cats, the go-to medication is totally different. It's a calcium channel blocker, which has been shown to be incredibly effective for our feline friends.
So the vet and the medications are obviously key players here, but they're only one part of the equation. The most important person in managing this whole condition and making sure your pet has a long, happy life, well, that's you.
So what does that look like? It means being proactive. Go ahead and ask for that screening for your senior pet. It means being observant. If you notice any sudden changes, like with their vision or if they seem confused, call the vet immediately. If they are diagnosed, you have to be super consistent with that daily medication. It's absolutely not optional. And finally, you have to understand this is a marathon, not a sprint. It's all about long-term management to protect their quality of life for years to come.
So there you have it. We've pulled back the curtain on the silent killer. We know how it hides, how we find it, and how we can fight it. The damage it can cause is absolutely real, but it is also treatable and preventable. So the only question left is, what are you going to do with this information? A simple conversation with your vet really could change everything.